I'm not saying people don't manipulate and that they don't do so intentionally. But what I'm arguing against here is this idea that there's a sort of category of person, and we call them narcissists, and their behavior is defined by bad faith, intentional Machiavellian manipulations with the sole intent of destroying other people. Because I think that posits malice where it's not really needed. I think it's better explained, and in my clinical experience, more true, that these behaviors are based on a complex internal array of defenses of which the person may be completely unaware.
Dr. Mark Ettensohn, what do you make of the argument that narcissistic personality disorder is caused by genes?
Getting right into it. Yeah, well, I actually watched your interview with Dr. Salerno, or at least the majority of it. I thought it was a good interview. And I understand that, at least in online spaces, he's probably doing the majority of the forwarding of that particular hypothesis. I'm actually going to be having an online dialogue with Dr. Salerno in a few weeks on a different channel. So I've been familiarizing myself with his work in preparation for that. That's kind of a long way of getting into my thoughts about it. I think that we've known for a long time that heritable traits play a significant role in the development of adult psychopathology. One way of thinking about that would be to discuss the construct of temperament, right? So, the idea is that temperament is heritable and it's largely biological. And what is meant by temperament is sort of the infant or child's responsiveness to the environment, sort of like how their individual nervous system is constructed. Right. So, some babies are fussy. Some babies are easier to soothe. Some babies, respond well to being swaddled. Other ones don't, that kind of thing. There's colicky babies and that sort of thing. I know that probably seems like we're going back an awfully long way in development, but that's really the foundation for, how personality starts to develop, right? An infant who's more difficult to soothe is probably going to be more frustrating to the caregivers, who may or may not, depending on their personality or the issues going on in their lives or in the home, they may be more or less patient with a baby who's more difficult to soothe, et cetera, right? So you can kind of see how over time a dynamic or a series of dynamics would develop in the early care environment that is in some ways based on the genetic sort of temperament or biological temperament of the child. So I think that is a valid and important consideration when we're thinking about the origins of adult personality pathology. Because, by all indications, those basic traits or temperaments, they persist throughout the lifespan, right? Somebody who's more sensitive to discomfort will probably remain so to varying degrees throughout their lives, right? And the ways that they then come to adapt to their environment, the ways that they come to then think about and represent to themselves what it is to be alive in the world, embodied, these sorts of things, right? The very foundations of selfhood in some ways will be impacted by that. I think, though, to go from that argument to the idea that a complex personality construct like pathological narcissism or NPD is genetically caused or genetically determined is a pretty big leap to my mind. I think part of this issue comes down to how we're defining pathological narcissism. And I think Dr. Salerno said the same thing in his interview with you. Isolate two experts, and ask them, right, what's narcissism? And they're probably going to give you different answers. And that, I think, is more a reflection on just how kind of a shambles our research and diagnostic paradigms are with respect to NPD. It's not that, one person is wrong and the other person is right, or one person's uninformed and the other person is informed. It's more that they're placing their focus on different facets of this construct. I think it's easier to make a case that certain traits that are, sort of adjacent to NPD, like traits like antagonism or things like that are more easily studied in terms of heritability, just because the research kind of engine around them is more robust and established. I think it's easier to kind of make that argument. But I think at that point, we're kind of back to the thing that I talked about in the beginning, which is that, okay, there are some kind of like, genes make the canvas, so to speak, right? But experience paints upon it. And there's an ongoing dialectic always between our genetic endowments or vulnerabilities and our experiences across the lifespan. So I think there's always going to be a dialectic between those two. I don't think that we can really collapse anything, as complicated as a mental disorder down to, well, it's just a gene or a series of genes. I think, but we discard the ideas about heritability at our peril, right? There's a lot of history, especially in psychoanalytic theory, that comes across as like parent blaming, right?
Mm-hmm.
Oh, you
Yeah.
didn't nurse the baby enough, or you didn't swaddle the baby right, or you didn't whatever. Well, you weren't responsive enough in some ways. Now, I think that's accurate to a certain extent. But again, if we cut out the constitutional sort of features of the child themselves, right? How they came into the world, sort of how their nervous system is organized, then we're getting rid of a very important piece of information there. So I guess to kind of distill it down, I think that personality disorders are complex, defensive adaptations that are dynamic. So they're not static. We're not talking about traits. We're talking about a process inside the individual that they use to negotiate threats or perception of threat, emotional threats, environmental threats, relational threats. We're talking about how they construct their image of self and others. We're talking about very complicated, overdetermined behavioral constellations that exist in different relationships in their lives, including their relationship with self. And I think that to say, oh, well, all of that complexity can be distilled down to a kind of genetic determinism argument, that seems incredibly reductive to me. Because it doesn't hold the whole person.
Right.
Right.
Yeah. Yeah. I think that sort of reduced deterministic answer would be the straw man that we'd be looking at.
Yeah.
An interesting idea that I've heard is that the genetics shape the brain, and thus the brains of these people are less capable of empathy. And then a life with less capability of empathy makes for less of a conscience, which makes for these behaviors. What do you think of something more like that?
Well, gosh, I think it's just all so incredibly complicated.
Hmm.
When I think about lack of empathy in the context of pathological narcissism, what I'm really thinking about are low empathy states, as opposed to empathy as some kind of static trait that either a person has or doesn't have, or they have it in a certain quantity, right? or there is, I think oftentimes there's kind of this somewhat false dichotomy that's drawn between the idea of cognitive empathy versus like emotional empathy. Um, I think that when a person is subjected to particularly early relational trauma, so I'm talking about in the first 4 years of life, let's say, when they're trying to consolidate a basic sense of self and to construct like the basic foundation of identity that's going to then they're going to build on, right, across the rest of their life. Um, if if the relational environment doesn't permit them to integrate different self states, right? In other words, if it's not safe emotionally to be mad at mom or to ask for something too many times or to openly express things like sadness or fear, stuff like that, right? That kind of thing happens in families. Um, then there's a defensive process that takes place that's essentially dissociative. Those different parts of experience have to be kept separate, right? And we call that splitting. When it shows up in a mature adult in terms of their defenses. But basically, what that is, these are different centers of gravity, sort of that contain different pieces of identity and different associations with different relationships and different even whole memories that are sort of different. Um, and when a person goes into a sort of an altered self state, right, um, they may lose access to their ability to empathize from within that self state. In other words, if they perceive themselves suddenly as a terrible person who's worthless, and they perceive you, let's say, if you're in a relationship with them, as hypercritical and exacting just sort of bad, like you're both bad in this constellation, their access to empathy from within that self state is going to be impaired. Versus if everything's going fine and it's Christmas morning and it's, or whatever, right? And everybody's having a good time, their access to empathy may be far less impaired. And so I see empathy as a dynamic, kind of fluctuating process. And we know this to be true, right? If somebody's really distressed, how able are they going to be to empathize with you because you stubbed your toe right now or because you feel sad, right? Their ability to empathize is probably going to be diminished in that state. If somebody's grieving, they're probably not going to be as empathic toward the people around them. If somebody has a debilitating depression, they're probably not going to be as empathic or receptive to the needs of those around them. If somebody's having a panic attack, right? We could go on and on and on down the list of all the different psychological symptoms that can manifest for a person. And if there's distress involved, then their access to empathy is going to be diminished. And the same thing goes for people who have personality disorders, and not just NPD, by the way, but any personality pathology that's significant enough means they're going to be going into these altered self states, these split off experiences where they perceive themselves to be under threat, emotional threat, sometimes physical threat, right? And in that mindset, even if it doesn't make any sense to you, from within their kind of internal psychological system, they perceive themselves to be in danger, and their empathy is going to be diminished in that self state.
Using phrases, threat, danger, safety. So
Yeah.
this sounds like a defensive thing, and yet what it seems to present at is very aggressive. And if you look at relationships with these people, and we've used different phrases now too, pathological narcissism, narcissistic personality disorder. But let's say a relationship with, a seriously narcissistic person who's dangerous to others, who is manipulative, abusive, that kind of thing.
Okay.
When they meet someone, they will immediately start smearing their reputation to others. They will devalue them in ways that are perceptible and stressful to that person. They will go through a whole relationship like that. And then on the back end, they will smear campaign, they will isolate, they will withhold resources, they can use the legal system. So it appears very aggressive in the relationship and even on the front end and the back end, as though it's premeditated. And then it's also to, cut that person off so they can move on to the next target. I mean, it looks extremely predatory. So what is going on that matches up with this predatory model and yet is defensive, safety, that kind of thing?
Yeah. Well, it looks predatory, and in some ways it may be predatory in how it manifests, right? But I think if we're talking about actual NPD, as opposed to, I mean, the idea of NPD, and your question kind of points to this,
Yeah.
is often conflated with traits that are not NPD, right? Especially psychopathy. So and sadism. So I want to take those out of the picture a little bit here, because if those are involved, then we're talking about a slightly different construct called malignant narcissism, and we can talk about this terminology and kind of what it means, at least to my mind, more. But again, not everybody agrees, right? Um, but I think when we're talking about somebody who has NPD, and that's now we're talking about a personality disordered level of narcissism. Um, their whole sort of psychology tends to revolve around something called paranoid anxiety. Paranoid anxiety is anxiety about annihilation of self, essentially. Not just physical annihilation of self, but emotional or psychological annihilation of selfhood. This is the state, the kind of embattled, defensive, hyper-reactive state that individuals who have personality disorders go into when they start behaving in ways that strike other people as outrageous, inappropriate, externalizing, right, devaluing, um, that sort of thing. Okay, so this is a psychological state where the person is flooded with a kind of danger or a perception of danger that they feel they have to um, protect themselves against kind of at all costs. Now, I want to be clear that this doesn't have to be a state that's represented to the person in their mind consciously. They may not realize that they are experiencing this paranoid anxiety, but it doesn't mean that they're not, right? And again, this kind of the idea here, that the kind of theoretical underpinning is that this state is reflective of very early experience where they, were experiencing some kind of traumatic, recurrent situation in their family of origin, with their caregivers, maybe with peers, right? So, in other words, there's this, this is the nature of psychological trauma, that when it's triggered, it's not as though the traumatic situation were happening again. For that person, the traumatic situation is happening again. There's no psychological distinction for them between what's happening right now and whatever the trauma was years or decades ago, right? And especially for people with these conditions, we're talking about lifelong complex trauma, because these traumas build on each other. So you may be talking about 100 different kinds of trauma that are getting triggered, in a situation that seems as benign as meeting somebody at a party, right? And so they then flip into this essentially defensive state of mind, where the goal psychologically is to expel whatever anxieties or perceptions about self feel unbearable or intolerable. Right. So let's say that somebody grew up in an environment where they were chronically made to feel humiliating shame. Right. Now, the psychology of a growing person can't sort of integrate that experience in a productive way so it remains split off, kind of dissociated in this other self state, the ashamed, humiliated self state. That's also probably filled with rage. Right? Um, Now they're at a party, they're meeting you for the first time. There's something about how you look at them or your tone of voice that triggers this experience, right? And again, it's not, oh, this is like that's happening again. For the person emotionally, this is happening again. Now they're flooded with the shame, with the humiliation, and with the associated rage of these experiences. And it's directed at you, right? Even though all you did was just say hi, something about your hair, I don't know, whatever it was, right? And the fact that the person is so reactive to such seemingly minor aspects of an interaction speaks to the level of psychopathology, right? I think a lot of times people say, oh, well, that person's behavior is so extreme, it must not be mental illness. And it's like, no, the more extreme and unusual a person's behavior is, the more it argues in favor of it being the result of mental illness, right? So for this person, they're so disordered because of the pervasive traumas and all of the internal adaptations that have had to be constructed to manage them, that even just meeting you at a party flips them into this split off state where they see you as bad, or maybe they're defensively devaluing you, right? And that's what that is essentially just trying to expel their own shame, right? Get rid of it because they can't process it. Right? Being able to process those feelings in a productive way that maintains interpersonal affiliations, well, that's a sign of a healthier personality, which this person doesn't have. Right? And so they can go through this whole kind of cycle that you described, discarding and then kind of smearing and the whole time feeling completely 100% justified and self-righteous about it. Without ever having to sort of have the diabolical, manipulative scheme that I think a lot of people read into this sort of behavior. Right now, I want to be clear. I'm not saying people don't manipulate and that they don't do so intentionally. But what I'm arguing against here is this idea that there's a sort of category of person, and we call them narcissists, and their behavior is defined by bad faith, intentional Machiavellian manipulations with the sole intent of destroying other people. Because I think that posits malice where it's not really needed. I think it's better explained, and in my clinical experience, more true, that these behaviors are based on a complex internal array of defenses of which the person may be completely unaware.
Mm-hmm. So we're talking about an unawareness to how they're actually interacting when another person flips this switch, this paranoid anxiety idea. What of the even more proactive elements, the sort of hunting type behavior, the sort of setting traps, the luring, the building of a facade so that other people perceive this person as a safe person? For example, I've seen one of these people, and he has built really sort of a fan club of people around him who he's carefully groomed. He puts lots of time, money, and energy into creating a facade with these people. And then he goes public places. He brings things that people need. He tests boundaries, and then people get lured into coming to him. It is premeditated. And yet and it's not caused by another person. This is something that he shows up with. He assesses people through group chats and social media groups and things like that before he meets them. So it's not triggered by a person. It's planned to be ready to hunt. How does something like that work?
Well, I think partly we're getting into a little bit of a quagmire with the verbiage, right?
Okay.
So if we start out with the premise that this is a hunt, then it's going to be hard to sort of think about that behavior in any other way than some kind of predation. And sure, there are people in the world who hunt other people, right?
Hmm.
There are people in the world who engage in, contemplated, premeditated manipulation um, for all kinds of reasons.
Okay.
I think that there's a tendency, and then now we're kind of getting into sort of the cultural construct of narcissism, to sort of lump all of this together under the kind of vague label of narcissism. It's something that I tend to call popular narcissism, this construct. And it's kind of an amorphous construct, like I was saying earlier. Sometimes it contains significant elements of psychopathy or sadism or paranoia or other issues as well, right? I think when we're talking about pathological narcissism, we need to kind of define our terms and then proceed from there, as opposed to sort of picking out different examples of behaviors and then saying, okay, now find the narcissism. Um, you know what I mean? Because it's like, well, okay, is there narcissism in that behavior? Sure, probably, right? I mean, it's self-aggrandizing in a way. Um, but then there's also this piece about like vetting people or maybe grooming them online for some, and I don't know what's happening there, right? Um, what I will say is that people like one of the characteristic um, aspects of personality disorders is inflexible, inappropriate behavior, right? So if somebody feels that the only way they can sort of show up in a meaningful way in the world is to be vetting people online and sort of actively cultivating some kind of fan club, I think it speaks to the absolute depth of their interpersonal need, right? And just how fragile this person's self-concept is, that they require this this these groupies to be constantly providing them with some kind of flattering image or feedback. Healthy self structures don't need that, right? When a person does need that, and especially when they need it to the extent that they engage in such inflexible, kind of like bizarre energy sapping behaviors like that, it's like, okay, well, this is a person whose whole life revolves around the need to constantly prop up a very fragile experience of self. Um, if there was ever an argument for mental disorder, I think that's a pretty good one, right?
Mhm.
Because it serves the defensive purpose of the individual psychology, but at the cost of real intimacy or of meaningful, affiliation and belonging, right? And frankly, I would imagine this person burns through groupies just as fast as they can recruit them. So at the end of the day, this is actually a very isolated individual, and one who is desperate. There's a desperation there that the person probably can't see in themselves. Other people can, and that's what I mean by sometimes the underlying motivation and trauma is unconscious. The person can't represent it to themselves because to do so would trigger the paranoid anxiety. It's too threatening.
Dr. Ettensohn, you've talked about coming to terms a little bit on what we're talking about, and you make great distinctions in some of your podcasts and your book and things about a dimensional way of
Oh,
looking at this
yeah.
versus categorical, which
Yeah.
I would like to talk about. I just want to get back to one more thing that you said, which is that this is sort of defensive, that this is a trauma thing. And I would wonder, would trauma therapies then treat it?
Well, I think aspects of trauma therapy are present in any good psychotherapy, right? Where you're constantly checking in with the person in big ways and little ways. You're teaching them to reflect on their level of internal activation, their level of distress, and helping them to learn, again, sometimes in overt ways, like let's take a moment to breathe together, but often it's in the context of the therapy relationship. You are, as the therapist, right? Me, I guess I'm the therapist. I'm a regulating presence,
Yeah.
right? The person can't self-regulate. That's why they're disordered. That is why they're disordered. And so they come into the therapy and they start doing the things that they do out in the world that are dysregulated. And I'm there to say, whoa, let's hold on a second. What's going on right now? Right? What is that thing you just said about? Like, really? Or when the thing happened with your spouse, what were you feeling? What were you thinking? To like actively promote a self-reflective capacity that otherwise might not be there. Because to be able to really reflect on your own thoughts and feelings, it has to be safe enough to do so. And this is a person, presumably, that grew up in an environment where it wasn't safe to do that. There's too much emergency. Everything was on fire all the time.
Hmm. So would something, as sort of what's become now a popular trauma therapy, like say EMDR,
Mm-hmm.
be useful in treating something like narcissistic personality disorder?
Well, I think it would be useful in treating some of the symptoms of it. I think so. The way that I practice is essentially we would call it relational. Um, I believe that these issues are caused by traumatic experiences that occur in the context of early relationships. And so I think, therefore, that the best treatment for them is to have a different kind of relationship, one that's safe and bounded by the therapy frame, where the sort of purpose is to gradually over time unpack some of the issues that have just been too surrounded by paranoid anxiety and emergency and threat and rage and shame. Um, just to kind of slow it down and begin to unpack those gradually over time, such that they can then be looked at by the kind of grown up part of the person, understood for what they are, which is old pain, and reintegrated with that new understanding so that the person doesn't have to just lash out or strike out from this wounded place inside all the time, but rather they can sort of respond to the signals of threat as they arise in a way that doesn't require them to burn bridges and blow up their relationships.
Yeah. Dr. Ettensohn, I'm wondering with all this, uh, what about someone who is malicious to begin with and then, gets into a therapy environment where they can learn the vocabulary to sound more like people want them to sound, say the right things. I mean, you've worked with people, so I imagine you have some sort of filter to understand when there's manipulation and when there's a sincere effort to change. But how do you see it?
I mean, I think everybody who goes into therapy goes in with the intent on some level to manipulate the therapy experience to get their favorite outcome, right? Yeah. We all enter therapy with whether it's a conscious idea or an unconscious one that, we're going to sort of engage in this relationship in such a way that we reach whatever our idea of health is or
Okay.
recovery is, right? And so as a therapist, I'm always thinking about that. It's called attending to the process, basically,
Hmm.
right? I'm never just taking what a person says at face value because um, I don't I don't know what actually goes on outside the therapy hour, right? And I teach this to my students and supervisees as well. Everything the patient says, whatever they're talking about, whether they're talking about an argument they had or their life's ambition or their favorite football team, what you're actually hearing about is their psychology, right? And so from within that paradigm, if they're lying, then the lie itself becomes the sort of focus of the analysis, right? So so I'm always wondering, well, how does this person want me to react to what they're saying? Or how are they afraid I might react? What are they trying to get rid of inside of them that they find intolerable? what are they, in what way are they sort of using me in this moment to, let's say, prop up a fragile or fragmenting experience of self? What's missing from what they're saying, right? There are patients who talk endlessly about work and never about their spouse, and vice versa. And I begin to notice that over time, right? So if the goal of treatment is to sort of have this ongoing dialogue where you're opening up and you're taking a look together at a person's internal experiences, their feelings, their thoughts, their perceptions, their fears, then somebody who's consistently resistant to that process starts to stand out. At which point the focus of the therapy becomes that resistance, right? So I think any therapist who's just taking what the patient says at face value, or who perceives the goal of therapy, to be like, we're going to get to the heart of what really is going on, that's a fraught endeavor from the beginning. We all, like, personality pathologies are just exaggerations of normative human experience. And so, we all deceive, we all manipulate, we all coerce, just most of us do it in kind of a flexible and an adaptive way that is not too disruptive to our lives, right? When you're like dating somebody and you want them to have a good impression of you, are you not in some ways manipulating them? Sure. But is it mostly benign and in the service of a greater good? Yes, right? One would argue. But, if somebody is inflexibly impression managing all the time, well, that's disorder, right? And we need to think about what is the basis for that disordered behavior. Why do they need to do that so much? Why is there such inflexibility? And it always points to underlying vulnerabilities and anxieties. And the source of those is almost always essentially trauma, right? And when I talk about trauma in this respect, I'm talking about injury, the medical sense of trauma, right? Get a paper cut on your finger, that's trauma. Right? So it doesn't have to be like trauma with a capital T. It can be little injuries that build up over time that form barriers inside the person to normal um, and flexible emotional intimacy.
And Dr. Ettensohn, there's this idea that's perpetuated by professionals, I think, among and others, and not all professionals, that narcissists can't be treated or that they will never get treatment. What do you make of that?
I think it's false.
Mm-hmm. I mean, you've seen it?
Did you want me to say more?
Yeah.
Yeah. Yes. Yeah, I've seen it. And I made a video about it just a few months ago. There was a Harvard study published in 2024 where they people, by the way, went berserk when I posted this video. But it's because it's a small sample size. It's a sample size of 7, right? And because it's a post hoc analysis as opposed to they didn't isolate this group and then follow them for 2 years or however long it was. They went through the records of patients who'd been treated and did a post hoc analysis, which is a normal way of doing psychological research. But people don't know that. And so they're like, oh, they made it up after the fact and whatever else. This study was done at McLean Hospital, which is affiliated with Harvard, which is another thing people had issues with. But that there's a group there that really does specialize in investigating and treating pathological narcissism. Some of the biggest names in the field were involved in this study. And what they found was that they were looking for proof that somebody with diagnosed NPD can make a full remission, right? So they went looking through their records and they found 7 patients who fit this description, who would qualify for a diagnosis of NPD and who experienced full remission. What's meant by that? It means they no longer qualify for the DSM diagnostic criteria, right? They no longer meet 5 of the 9 symptoms that are listed there. People said, oh, well, there's only 7 participants. How can you generalize from that? Well, you don't need to. They're asking, is a phenomenon possible? Right? They only needed 1 patient to show that. One patient with diagnosed NPD who experienced full remission. Boom. It's possible, right? But instead, they found 7 within the same cohort of patients at the same hospital, which to my mind argues that this is a phenomenon that's not nearly as rare as people like to think. Um, there's nothing essential about NPD that makes it the one untreatable personality disorder, right? Yes, the defensive sort of matrix of NPD is particularly challenging because of how the person tends to show up, right? Which is usually, if we're talking about kind of classic stereotypical NPD, there's a grandiose armor, right? It's hard to get the person to sort of recognize that they need anything because their defensive constellation is whenever a need is recognized, it's immediately externalized. I don't need anything, you do, right? You're the one who sucks. I'm great, you know? I mean, that's essentially the grandiose defensive maneuver.
Oh, yeah.
So it's really hard then if you're sitting with somebody like that to be like, don't you really need something? You know, that turns into an argument, right? It doesn't go anywhere. The good news, though, is that for people with NPD, I guess, is that grandiosity isn't the entirety of the disorder. There's always an underlying vulnerability, right? And what tends to happen is that the person's grandiose defenses collapse periodically in the face of, the slings and arrows of fortune, right? They're fired, their spouse tells them they're terrible in bed, whatever it is, right? And it's just enough to collapse that grandiose self-image. And what that collapses into is that kind of bottomless pit of interpersonal need we were talking about. And there's often then a depressive experience that emerges or an overwhelming anxiety that emerges. Their interpersonal avoidance tends to collapse into something that's more preoccupied or fearful avoidant, which is where attachment anxiety is stronger. They need people all of a sudden. But needing people is antithetical to the self-image, right? Because that conjures up shame and humiliation, which then triggers paranoid anxiety. So now they're stuck, right? And this can lead to some pretty extreme forms of acting out, up to and including suicide. NPD is significantly correlated with completed suicide, right? So this is an at-risk population in that respect. These people kill themselves when the grandiose self-image is collapsed. And I've seen it in my practice. Nobody's ever completed suicide in my practice, but I make suicide plans with people, safety plans. So that's the side of this issue that people don't see. The trick, right? The art of it is to recognize that the depressed person sitting in front of you is depressed because of an underlying narcissistic pathology. And then to be able to kind of help the person stay in treatment, even when the vulnerable self-image is gradually replaced by the compensatory grandiose self-image. And it doesn't always work. I mean, this is a difficult disorder to treat. It's why very few people specialize in it. I must be crazy to specialize in it, right? Like it's hard. But it's not hard because it's essentially untreatable. It's hard because over the course of treatment, there are so many opportunities for the treatment to fail. So it's like, what's a good analogy? I'm trying to think. Like, is it hard to run a marathon? Yeah. Is it impossible? No. What makes it hard? Well, you get tired. And your legs start to hurt. And it starts to seem like a really good idea to just take a break and just sit down for a while. You know what I mean? It's like going the distance is the hard part. But it's not that it can't be done.
Yeah. Dr. Ettensohn, we talked a little bit before about the categorical versus dimensional idea, which I think maybe now is a good time as we're talking about people who have this diagnosis and things like that.
Yeah.
Could you share what your thoughts are on the dimensional versus categorical way of looking at this?
Yeah, I think the best way to look at it is a combination of categorical and dimensional. So, and just for the viewership, I guess, a categorical way of looking at this would be like what you find in the DSM, right? Here's BPD, here's NPD, here's antisocial, here's paranoid, here's right. So, like these are as though these are discrete, circumscribed um, entities, right? Oh no, I have this disease, not that disease. Right. So that's a categorical model versus a dimensional model, which is more like a continuum or a spectrum, where they kind of are recognized to sort of blur into each other in various ways. And there's a kind of hypothesized underlying construct, what I would call personality health or personality organization, that sort of determines where a person is on that spectrum. So the way I think about it is like this. We all have one or more categorical personality styles, right? So there's and a personality style is organized around core conflicts and concerns. So a person with a narcissistic personality style, their kind of defenses are organized around issues pertaining to self-image and self-esteem. Specifically, they seek self-esteem inflation to defend against self-esteem collapse. That's a narcissistic personality style, right? Not saying anything about disorder, right? The person can be totally healthy, but still be organized around this core conflict. Right? Other personality styles have different core conflicts, right? Paranoid personality style is organized around perception of threat, for instance. Borderline personality style would be more organized around issues of merger versus separation or abandonment. Okay, so these are, and a person can have more than one of these, but there's usually a dominant one. That's the categorical piece. The dimensional piece has to do with personality health or personality organization. And this is a psychoanalytic concept now, but I'm a psychoanalytic therapist, so that's what I talk about. And that's sort of a progressive movement that from infancy through adolescence and early adulthood that involves gradually differentiated, consolidated, and clear images of self and other. So when we're born, we have no differentiated idea of, oh, I'm a self and you're another, right? Where would that come from? You know, like a baby's not like, oh, I'm a baby, right? I mean, it's not, it's all just a blur of experience. And it's gradually over time that they begin to separate and differentiate those experiences into pleasure and pain, into, oh, this is what happens when I'm eating. Oh, this is what happens when I'm, being held. Oh, this is what happens when I'm scared. Like, but not using that language, right? And that's where the images of self and other begin to emerge. What is self? Well, what is other? Well, it's not self. What is self? Well, it's not other. So these are mutually co-constructed ideas. So on this spectrum of personality health, it's separated into four sort of zones. The first one would be a psychotic personality organization. That's kind of pertaining to the earliest experiences where there's no separation between self and other. Then there's a borderline experience, which is where those images start to differentiate a little bit, but they're still blurred together. Then there's what's called a neurotic phase, where it's more like those images are separate, and now the person begins to be preoccupied with guilt, right? Because if you're separate from me and I hurt you, I can't magically reconstitute you by projecting or by using whatever more primitive defenses I might use. So once there's an other that's separate from self, now adult relating becomes possible. And then the final would be like, the castle on the hill, right? Like healthy personality, which none of us have. So, but like, so when we're talking about personality health, somebody can have a narcissistic personality style and be healthy, which means that they consistently recognize the differentiation between self and other, and they behave accordingly. They're concerned about injuries they may have caused you. They're interested in making repairs that are meaningful, right? They're able to tolerate distressed self states in a way that it utilizes more mature defenses like humor or like the word just flew out of my mind. I'll think of it later. If somebody's in that more borderline range, which is where most personality disorders occur, then they're often behaving as though you and them are not separate, right? They're projecting their own fears and insecurities into you, and they're engaging in reality distorting and boundary blurring defenses. And then if somebody's in the psychotic range, well, that would be like the most severe NPD. And that would be where they're having, hallucinations or delusions, where their internal experience is fragmenting in a psychotic way, which is terrifying to for them to experience, right? And where you get the most sort of disordered, inflexible, paranoid behavior at that psychotic end of that spectrum. So again, just because somebody is narcissistic doesn't mean they're disordered. Disorder pertains to the personality organization spectrum. And the goal of treatment is to help somebody move up that spectrum, so to speak, to develop a more cohesive image of self, a more differentiated image of self, a more stable image of self, and to increase their reflective capacities so that they can begin to reflect on these dissociated self states and the experiences that they contain, and thus behave in a more flexible and kind of unified or coherent way in the world, as opposed to the inflexible, kind of inexplicable, disordered way.
So many people could have a narcissistic style, but a distinction is whether or not there is that reflection and the recognition of others.
Yeah, I would say so. And it gets more complicated than that, but it's like the more distress the person's experiencing, the further regressed their object relations tend to be. So the further down that scale they tend to go. Hit anybody with a big enough trauma, and they will absolutely periodically, temporarily regress into what we might call a psychotic state of mind. But if they already have those kind of more mature ego defenses and capacities, then they'll put themselves back together. Get into a strong enough argument with your significant other, and you are absolutely in a borderline range of negotiating experience. But if you're otherwise healthy, then you, after the argument, you're like, look, I'm sorry for the things I said. I know I was upset. I know it was unfair. I don't really think those things about you. I just, right? You can make a repair.
Hmm.
Versus somebody who kind of functions more consistently in that borderline range. And this is not the same thing as borderline personality disorder, by the way. The terminology here is all messed up. But
yes.
But somebody who's more consistently in that disordered range of the personality health spectrum won't be able to make that kind of a repair. They'll go get wasted to try to substitute a pleasurable self state for the unpleasurable one. Or they'll buy you a big, outrageous gift and expect that to magically make everything better. And then if it doesn't, then they're outraged, right? Because now they perceive you as persecuting them because you're not conceding. You're not colluding with them in the fantasy that we can magically make everything better.
Yeah. So, Dr. Ettensohn, we're talking about seeing things as categorical and yet as dimensional. We're talking about relationships now. So, if you have a relationship with a person and you see a pattern of behavior that starts to look like narcissistic personality disorder, what do you do knowing that there are these dimensional and categorical ways of looking at this? There's often advice that if you recognize somebody as NPD, you run. So how do we sort through all this using these more nuanced ways of looking at it?
It's a good question. But, I think, honestly, what we ought to be talking about here is just like the broad category of interpersonally unacceptable or abusive behaviors, right? There's nothing particular to NPD that makes it like the disorder that people need to run from. You know, any personality disorder involves the same kind of undifferentiated self and object images. Any personality disorder involves the same kind of impaired empathy states. Any personality disorder utilizes the same borderline or psychotic level defenses: projection, denial, splitting, projective identification, acting out, externalizing, right? All of these things, you're going to find them in anybody, regardless of their personality style, if they're at a disordered range of this spectrum. So, I think that what people should look for in their relationships is reciprocity, right? A kind of collaborative alignment that's consistent with the other person. You feel consistently seen and understood, and it seems that they feel consistently seen and understood by you. A mutual respect, right? So, nobody's, for the most part, nobody's saying or doing things that are out of bounds, you know? Um, a kind of a basic consistency in terms of how the person's relating. If you're seeing like wild fluctuations in the person's behavior or how they seem to feel about you, and the person doesn't seem aware of those fluctuations, then that's a sign that there's something like splitting involved, which is a borderline level defense. And splitting is not something the person's doing intentionally. They're getting triggered and identifying with dissociated self states that contain all kinds of muck, all kinds of trauma, all kinds of reactive perceptions. And when they're in that self state, they don't see you in the same way they did 5 minutes ago. They see you as bad. They see themselves as bad, or they see themselves as good and you are idealized, or whatever it is, right? There's some distortion happening. And they don't have access to the same memories and associations that exist in the non-split off self state. So, not only are you bad right now, but you've always been bad. And everything you've ever done is reinterpreted through that lens until they've calmed down and maybe they're out of that split off self state and they're back in kind of the normal one. And now they can maybe see you more accurately. But in that case, they now have no memory of what was going on in the split off self state. And that's where gaslighting comes into play, right? I didn't do that. I didn't say that. What are you talking about? That's not something I would do, And you're like, dude, you did. And they're like, you're making shit up, right? And a reasonable person concludes, oh, this person is lying and manipulating. When I think oftentimes, especially if we're talking about a personality disorder, the person is not trying to lie so much as they are now in a different self state than the one they were in when they did whatever it was. And so, it can be crazy making and confusing, like really confusing if you don't understand these dynamics. And even if you do understand these dynamics, right? But one way to think about it is, like a very young child in some ways, will, they'll do something and you'll be like, why did you do that? And they will rationalize why they did it from within the state of mind they're in now. They won't be able to tell you about the state of mind they were in then, right? Because that is the function of a more mature, integrative, self-reflective capacity. And people with personality disorders don't have this capacity, at least not reliably. And so that's why you get the craziness. I would say that there's nothing prescriptive about NPD that means, oh, now you have to run, as opposed to BPD or something else. It's like if you love someone and they have a diagnosed personality disorder, or it seems like they may have a personality disorder, then you need to think about your own the quality of that relationship, what you're willing to um, tolerate, what the doctor says or the psychologist, or what the prognosis is, how engaged in treatment they seem to be. This raises a lot of questions. But I think oftentimes, if there's one member of a relationship who has sort of a personality issue, there's two members of a relationship that have a personality issue. And that's because people who have a more, who are higher up on that spectrum of personality health, they tend to recognize these kinds of behaviors in these situations as unsafe, unreliable, and they tend not to tolerate it. They tend to leave sooner, or not get into the relationship to begin with. These issues tend to attract complementary personality configurations. So, I do assessments in my practice, and you know, uh, it, I found that to be largely true. Like, if there's been decades of like disordered behavior on the part of one member of the partnership, there's often some kind of complementary issue on the part of the referring partner. And they may not be aware of it, especially if they've been watching like thousands of hours of narc abuse stuff online, and now they're engaged in essentially an externalizing narrative of their own, right? It's not me, it's this guy. He's a big narcissist, you know. And I think there's a online culture that really encourages that.
So, Dr. Ettensohn, the counter argument to that I've heard would be that it doesn't take two to tango when you deal with a dangerous person. So, for example, like I've seen someone who was targeted who she grew up in foster care and all she wants is a family. And the narcissistic psychopath recognized this in her immediately, imitated the family unit, and took advantage of this vulnerability in her to develop control over her. So in that case, I see her personality as mostly not relevant because she was so clearly targeted. What do you think of things like that?
Is she a child? Are we talking about a child?
No, she's a woman, maybe 25 years old.
Oh, okay. Well, I would say that all right. So this gets kind of tricky, right? Because it's very easy to unintentionally sound like I'm dismissing the validity of, abusive situations and the necessity to not tolerate that. So I just want to be very clear. I'm not like advocating, that like I'm not like trying to like erase victimhood here. I'm not saying that there aren't situations where, there's a very real danger or a very real dynamic, domestic violence, emotional abuse, verbal abuse, sexual abuse. No one should tolerate that or stay in a situation where that's happening. And if you are in a situation where that's happening, um, you know, seek help, seek support. Absolutely 100%. Right. That being said, somebody who grew up in the foster system you know, there's probably some vulnerabilities there that make them a better target, so to speak, especially for somebody who has psychopathic tendencies or for somebody who's just operating in the world in a way that is exploitative of other people, regardless of whether it's like a studied thing or a predatory thing or a whatever kind of thing, right? Um, so, I don't think that we can ever say, oh, well, the receiving party's psychology is irrelevant, because at the very least, I think there's often the kind of dynamic that uh, somebody who's operating in a predatory fashion isn't going after the ones who seem self-assured and like they're going to say something or do something, you know. So it's complicated in that way. Again, it's like there are complicated like levels of sort of what's going on. Like abusing somebody is always wrong. Now the question becomes how much intent was there, and that's a mitigating factor, but it doesn't undo the fact of the abusive treatment. And then there's also the question of, well, what are the effects on the person who received it? And that is a function of their psychology to a certain extent. And also, if we're taking like a really big step back, we're looking at sort of the dynamics that led to that happening. But yeah, so when I say like, oh, well, if there's one person with sort of a personality issue, there's probably two people. I'm not talking about like situations where one person is just abusing somebody else, right?
Sure. Yeah.
I'm talking about, and this is again, I think in the online discourse, like NPD and abuse are often treated as the same thing.
Yeah.
So it's like impossible to talk about narcissism without everybody thinking I'm talking about abuse and abusers. And I'm not, because there's nothing about narcissism that like pathological narcissism that says you must be engaged in some kind of abuse of other people. Oftentimes people with these issues are abusive toward themselves, right? That's why suicide is a factor. They're devaluing of their own self-experience. One way that grandiosity can show up is in the form of a kind of inverted grandiosity where they believe themselves to be worthless, right? They're the best at being terrible. They're the best at being, without merit. So, what I'm talking about are relationship dynamics that involve some kind of disordered inflexibility, some kind of persistent and recurrent blurring of interpersonal boundaries, some kind of persistent and recurrent pulling into a kind of merged experience where the boundaries between self and other are not functional. And I do think that happens more readily when both people have issues with that. And it's far harder for something like that to happen on a persistent basis when one person in the relationship has strong, clearly defined interpersonal boundaries and the other person doesn't. That's a recipe for breakup.
Mm-hmm. Yeah. What was that phrase you used? Persistent inflexibility, pathological inflexibility?
Persistent, I think.
Persistent inflexibility. Yeah, that's really interesting because across many different models for this that I've seen, I mean, there's people who talk about it from a clinical level, oh, it's an NPD or psychopathy or something. There are people who talk about a persistent predatory model, a person of low conscience and a low conscience umbrella. This inflexibility, this sense of control seems to be the theme, is that they need to control some sort of dynamic. What can we look for in relationships when it comes to how much control there is with another person?
Well, again, I'm kind of, and this is probably going to be frustrating to your audience that I keep kind of stepping back and saying, well, we don't have to be talking about narcissism here.
Yeah.
Right. Because a dependent person is going to, like somebody with a dependent personality style, let's say organized at the borderline level, they're going to be just as controlling as somebody, who has NPD.
Mhm.
Somebody with BPD who's like, engaging in kind of like emotionally like clutching, grasping sorts of behaviors, desperate, displays of or threats of self-harm to try to keep the other person from leaving or asserting independence. That's controlling, you know? So whenever we're talking about this kind of more disordered range of personality functioning, you're going to find inflexible, anxiety-driven, controlling behaviors. Somebody with obsessive compulsive personality disorder, you know, you didn't clean the kitchen well enough. There's a spot on the counter here. Why do you do this to me? Why don't you know how much this stresses me out? Don't you know how hard it is, how hard I work? Yeah, right. Raging about the spot. Now, they're not really raging about a spot on the counter, right? This is about their own paranoid anxiety. This is about their own inability to cope with the stresses in their life and in their psychology that they're now externalizing onto a spot on the counter, right? And now engaging in an interpersonally blurred boundary scenario where the other person is now responsible for removing the stressor, which is identified as the spot, right? In other words, you're responsible for maintaining my psychic equilibrium. Okay, so so in NPD, right? We're talking about somebody who has a hard time maintaining a stable, basically positive self-image, right? And so they have to inflate their self-image. And if they don't do that well enough, then it collapses into a devalued, vulnerable state, right? So the way they inflate the self-image is through interpersonally controlling behaviors. Look at what I did. Isn't it great? Wait, you didn't smile big enough. You didn't praise me highly enough, right? How could you do this to me? Don't you know how stressful it is? It's the same thing as the spot on the counter.
Yeah.
So the control is an attempt to manage internal insecurities and paranoid anxiety by blurring interpersonal boundaries and making you responsible for maintaining their psychic equilibrium.
Well, Dr. Mark Ettensohn, before we get to our last topic, where should people look for you online if they want to learn more about this?
Oh, I've got a website called healnpd.org, but most of my stuff is on YouTube. My channel is called Heal NPD. I make both. I try to publish weekly. I make short form videos that kind of try to address one or kind of a limited little issue. But I also make long form videos. Like for instance, I have gosh, I don't know, it's going to be a 5 or 6 part video series about personality organization, explaining these concepts: psychotic, borderline, neurotic organization, how they function, what are the characteristic defenses, what are the traumas that seem to lead to these issues, and perhaps most importantly, how a person can, through treatment, sort of develop and grow into more differentiated, more mature object relations and stuff like that. So yeah, it's a good resource. I think it's a good. Of course, I think it's a good resource. I think it's a good resource.
Yeah.
And my goal is to just like try to defy the pull, the cultural pull to just render, narcissism this kind of amorphous thing that's synonymous with abuse and evil, when that's not what it is. I mean, I don't think I told, well, maybe I said this, but I specialize in these issues clinically, right? I mean, this is what I do. I treat pathological narcissism. I assess it. I write about it. I make videos about it. I sit with folks for, you know, on a weekly basis, sometimes 2 times a week. on occasion 3 times a week for years sometimes, in an attempt to help them to kind of mature uh, in terms of their object relations and their self-image, and to really begin to develop some of these capacities that are missing for folks
Mhm.
who have these issues. So I really get a pretty strong and intimate portrait of how these dynamics function. I also talk with their loved ones, right? So it's not like I just, you know, take their word for it. I also talk to the people in their lives and hear how those behaviors show up in their relationships, and just really trying to help folks who identify as having these issues and their loved ones to understand that this isn't some kind of like evil so much as it is a mental disorder like any other, um, and that there is a path forward toward healing and integration.
Mhm. We'll put some links in the description, those things that you mentioned for people to check out. And that leads nicely into my last topic, which is you. I mean, you said before, you must be crazy to do this. Well, what got you into doing this?
Um, Humanism, like I, for whatever reason, really caught a glimpse early on in my training of the essential humanity and the tragedy of these issues. My first patient ever had NPD, and I was just at a loss. Couldn't figure out the dynamics in the room. Ended up like going to the library, my school's library, and I had just kind of lucked into some pretty solid um, conceptualizations, dynamic conceptualizations. So I started to get a sense very early on of how these issues seem to develop and how they seem to function inside the person. Ended up doing my master's exam on that patient. So a full case conceptualization and write up in defense of that therapy. I ended up doing my dissertation on the intersection between attachment and pathological narcissism, looking at the developmental origins, the traumas, so to speak, that give rise to these issues. That turned into my book, and I just kind of kept going. I just never lost sight of the essential tragedy that that causes, to my mind, causes these issues. You know, let's say the baby enters the world with a developmental, I'm sorry, a temperamental vulnerability, right? The genetic component. Okay, fine. But still, looking at their subjective experience as, you know, the kind of tragedy unfolds, right? It's just so compelling to me that I just I'm stuck on it. I don't know.
Hmm.
And because you know, I don't know. When I was in high school, I was on the mock trial team, and I was an attorney, right, on the mock trial team. Actually, my school's team were the state champions, so we were pretty good. And I was always a defense attorney, right? They were like, "Do you want to be prosecution this year?" I was like, "No, defense always." And there's something about the kind of underdog, the kind of, you know, I don't know, uh, something about that. It has always kind of lit a fire for me. So.
Mhm.
Um, I know that there are a lot of people who are kind of really stuck in these polarized ideas about NPD and narcissism, you know, who see it as synonymous with abuse and therefore see me as some kind of abuse apologist. And that's hard because I see myself as a humanist and somebody who is trying to help people heal from very early trauma and trying to change patterns in their lives that have been consistently disruptive and destructive, both to themselves and sometimes to other people. And trying to argue for a more nuanced, and grounded discourse about these issues, one that recognizes that we're all people, and doesn't kind of slide into this boogeyman, frame of mind where it's like, well, there's us and then there's them. No, it's we're all them. They are us, we are them. We're all people. And the issues that show up in narcissism are just exaggerated forms of the issues that show up in anyone's life. We all need to have self-esteem. We all need to have a positive self-image. We all rely on feedback from other people to help maintain that self-concept. We all get envious of other people, right? We all, you know, want to be successful and well perceived and liked. None of this is like totally outside the realm of normative human experience. It's just an inflexible, exaggerated version of that. And the inflexibility and the sort of pathology of it reflects the depth of need in the person's psychology. And that need is caused by deficits, and those deficits occur in early caregiving environments. And perhaps there's a genetic vulnerability that makes a person more likely to go down this path or to be more sensitive to perceived humiliation or something like that.
Well, Dr. Mark Ettensohn, for that perspective, for your book, for this conversation, for your time, for your work, thank you so much.
It's been great. Thank you so much for having me. Hope it's helpful to your audience.
To help raise awareness about narcissistic abuse, please share this video. It helps a lot.